Yesterday, Governor Mike Pence announced the approval of the Healthy Indiana plan, which would allow access to insurance for an estimated 350,000 more Hoosiers. Today, he was in Mishawaka to discuss the plan going forward. News Center 16's Sean Gallagher joins us in the studio. And Sean, how is this different from what Hoosiers on Medicaid already have?
Well, Pence is calling it a consumer-driven health plan. So maybe patients can take some ownership of their own health care here. And the plan will include even more of the Hoosiers working poor, but now they'll have to pay a monthly fee on top of it. So while Governor Pence says this is something he's heard Hoosiers want to do, and now they'll have the opportunity.
Governor of the state of Indiana.
Dozens of people gathered to hear Governor Mike Pence's take on HIP 2.0, an extension of the Healthy Indiana plan from 7 years ago.
This is a program that really deals with everyone at or near the poverty level who's an able-bodied adult, and requires people to make monthly contributions, encourages people to engage in preventative medicine.
The program looks to eliminate Medicaid for non-disabled adults between the ages of 19 and 64, although it is using federal Medicaid funding to pay for the costs.
I said early on that Medicaid's not a program that we should expand. It's a program we should reform. And here in the state of Indiana, we're reforming Medicaid in ways that I think are going to improve people's health and improve the well-being and the prosperity of our entire state as a result.
The difference now is that Hoosiers at or below the poverty line will now pay a monthly fee. And Pence says that's what the people want.
Hoosiers don't want a handout. They want a hand up. They want an opportunity to pay their own way for themselves and their families. And the Healthy Indiana plan, first of its kind in the nation, I think creates the kind of program that allows Hoosiers to do that.
The plan will cover up to $2,500 in a health spending account, and if you surpass that number, everything is fully covered at no additional cost to the patient. And if you don't reach that $2,500 line, that money rolls over and reduces your monthly payment next year.
It's going to encourage Hoosiers to take ownership of their health care and ultimately benefit our health care economy as a whole.
So HIP 2.0 is a little different than what people are used to because now they're going to be paying for it. So let's take a look at some of the numbers. For individuals who make about $1,300 a month, they're going to pay about $27 each month for that fee. And then couples, they're going to pay a little bit less. It's split between the two of them. If they make about $1,800 a month, it's going to be $36.61. Now, families of four, if they make about $2,700 a month, the two parents are going to split the $55.51 there. So this could be a big difference for those with low income, but Governor Pence says this is what Hoosiers want to do.
All right, it seems to be reasonably priced, but a lot of folks still are trying to make ends meet here. What if people simply can't afford that fee? Are they out of luck?
No, not at all. I mean, if people understand that they still may not be able to pay these fees, so they can sign up for the HIP Basic, which is no fee, no monthly fee, but they'll pay $4 to $8 for doctor visits and prescriptions, and also they could pay up to $75 for hospital visits. So it's essentially a copay for them instead of having to pay that monthly fee.
And they still have some type of ownership here, it looks like.
Yeah, exactly.
All right, Sean, thanks.